access to services and the quality of those services. And the MBS has been very good on this front. But you see now where we're going into a wider use of resources, to more services for more people, there's something else that has to come in, very importantly. And that is the efficiency of the use of these resources. Because if we don't use the resources efficiently, then that access we're talking about and that quality of services we're talking about will not last. It's not going to happen. The use of resources now becomes the central thing. And this is what the NHI is going to make sure happens. There are three pillars of the efficiency that the HU is going to try to help establish. What we're going to do, we're going to develop a costing framework for the health system, in the sense that we know that the health services, there has been some costing of services, but we are going to be looking at make sure that every single service that will have to be paid for by the NHI, we will be sure, we have to find out for sure what the cost of the service is. But it's not simply finding out that cost number. That because the framework we're talking about will give us not just the numbers, the framework will also tell us how the costs are being generated. And that is what we'll need to know if we have to manage the thing well. Because when we see costs being generated at levels that we are not happy with, then we'll know that we have to intervene and do something. So the costing framework then is the first pillar, and it will give the management of the NHI the capacity to monitor, because what we are going to be monitoring and making the changes as necessary in a timely fashion.